Top stories from around the island. To the point. Without the fluff. Puerto Rico headline news. Please subscribe and don't forget to hit the bell notification.
Hello and welcome to Puerto Rico Headline News for March 28th, 2020. If this is your first time here or you haven't subscribed yet, I ask you to please do so, like this video, and please don't be afraid to share this content, especially with friends or family and those that are living here in Puerto Rico who have a difficult time finding English-based news. There's breaking news as of this afternoon, late this afternoon. There was a virtual conference that was being held with the medical team or the medical task force in place to fight against the coronavirus. And it was revealed after some pressing from reporters from El Vocero that no contact tracing has been conducted at all on any suspected or confirmed cases and even deaths that have already occurred because of the coronavirus. Now, certainly it's very troubling. We've all watched movies, TV programs on pandemics and outbreaks, and we've seen firsthand how contact tracing is very important. And I assumed that it was being conducted here in Puerto Rico. So like I said, at this press conference, El Vocero was there. They pushed till they got some answers to their questions, and it was revealed that this contact tracing has not been taking place. So let's go ahead and go cover this article here. And it says, with at least 100 confirmed cases of the coronavirus, COVID-19, on the island, since the first cases were confirmed more than 2 weeks ago, the medical task force reported today that the vital contact trace operation is still in the phase of development and won't start until at least next week. It continues to say, in a matter of a week, we will develop a rapid surveillance system to respond to COVID-19, something that we did not have available in the Department of Health. Epidemiologists and regional epidemiologists, with the best intentions in the world, were doing what they could. The task force epidemiologist Juan Carlos Reyes said when asked by the El Vocero reporters on what he was doing with the contact tracing. Now, it's hard to say why they would not have some type of system in place, being that they had tons of time to prepare to put something into place before we had our first case here in Puerto Rico. But like he says here, they were trying to do their best. The article continues to mention, as detailed, the team of epidemiologists of the medical group are developing a rapid surveillance system to receive information from hospitals, laboratories, and the Luis Muñoz Marin International Airport on all confirmed cases. Now, this data collected on forms and through a protocol still in development will be updated daily. So hopefully it seems like they're on the right path to develop something. Obviously, it should have been developed a long time ago. But the article continues to say, right now, for the contact tracing, what is going to be done is, once these positive cases are identified, students from the School of Public Health and the Medical Sciences campus from the University of Puerto Rico, in conjunction with personnel from the health regions where the 8 epidemiologists of the region are located, will be used, added the epidemiologists. Now, Reyes said that they are in meetings with all the personnel from the health base, the airport, and the hospitals to finalize the details of the protocol. They're hoping to have a whole surveillance system in a week. We hope so too. The article continues to say, on the other hand, he indicated that Governor Wanda Vázquez signed an executive order for mayors, hospitals, laboratories, public and private, and all areas in charge of handling virus tests to report to the rapid surveillance system, which must be online this week. That information is going to be centralized so that we can then see how it is behaving, the coronavirus. Contact tracing depends on that working. We are going to start doing that next week, is what he stressed at this virtual conference. So the article continues to mention we are going to start and we are going to make mistakes, as it happens in everything. But we hope that by next week we will have data from hospitals, hospital admissions, intensive care units, use of ventilators, unfortunately, people who die, because it will happen. All this is being assembled to gather information not only on how the epidemic is maturing, but to make better projections and doing contact tracing, which we know is essential to be able to identify people, he added. Now, the source of the problem, they claim, is not having enough information at their disposal. Now, for her part, Dr. Marcia Cruz, also a member of the medical task force, pointed out that the health department has not offered precise information on each positive case at the moment because the data on each patient is limited. And then she proceeded to say, we have 100 confirmed patients, but we do not have all the details that are necessary to be able to then do the contact tracing. The only thing we have right now is limited details of these first 100 positive people. What does it mean? We don't even know when the symptoms started, what neighborhood they are living in. We have very limited details. She reiterated. That's very, very troubling. Now, in conclusion, this article said he added, or she added, that the recommendation to the Department of Health is to increase the details of each patient. Of course, we certainly want to do that, so that the task force can develop epidemiological data that will help provide a clear picture of how the virus is behaving on the island. This data will help us see how the virus is spreading, to what people, collect their contact information, collect when the symptoms started, among other information. Our goal, working in collaboration with the Department of Health and following the recommendations established by the experts, is that by Monday, every patient who is diagnosed with this disease in any laboratory, any clinic, any hospital, that information we will receive daily, she pointed out. And at the virtual press conference, the medical task force was unable to specify the health status of active coronavirus cases, how many are hospitalized, or how many are in intensive care. So it seems like with these first 100 confirmed cases here in Puerto Rico, they have no clue who they are, where they're at, when their symptoms started, any of those important details. They seem to not be able to collect that information. So here on out, though, for future confirmed cases, they are promising that they'll have the system in place to be able to do the contact tracing and be able to track everybody else who has been exposed, possibly exposed to the coronavirus. Now, if we think about that for a second, I mean that's 100 confirmed cases, families, friends, people that came into contact with these 100 confirmed cases who have not been contacted at all to make sure they're safe, make sure they're healthy, and to make sure that they're not uh, spreading the coronavirus as well if they're infected. So that's very troubling information, and it could explain why the lockdown has been extended for another couple of weeks. With this additional information, that might even be longer. And of course, that's a decision that the governor has to make. So hopefully, with the contract tracing next week, they'll be able to project and estimate and prepare for whatever they will need to do to be able to treat all those people. So again, thank you for watching. Again, if you haven't subscribed, please do so. Things are moving fast. A lot of updates are happening, and surely you wouldn't want to miss any of those important details that I try to cover. Okay, well, once again, thanks for watching and have a great day.